Today we will discuss about the vessels of the upper limb. First, we will talk about arteries. Major arteries of the upper limb are subclavian artery, the axillary artery, the brachial artery, and the ulnar and radial arteries. First, subclavian artery. Left subclavian artery is originated from aortic arch, and right subclavian artery is originated from brachiocephalic trunk. From their origin, the left and right subclavian arteries arch superolaterally and course toward the axillary region and terminated at outer border of first rib and continues as axillary artery. It has three parts. First part is the part before the medial border of the anterior scalene muscle. Second part is the part located posterior to the anterior scalene muscle. And third part is the part after the lateral border of the anterior scalene muscle. For branches, we have mnemonics, that is vitamin C and D. From first part, it gives origin to vertebral artery, internal thoracic artery, and thyrocervical trunk. From second part, it gives origin to costo-cervical trunk. From third part, it gives origin to dorsal scapular artery. Now, axillary artery, that travels through the axilla. The axillary artery is a continuation of the subclavian artery that begins at the outer border of the first rib. The axillary artery terminates at the lower border of teres major and continues in the arm as the brachial artery. For branches, we have mnemonics, that is save the lions and protect species. From first part, it gives origin to superior thoracic artery. From second part, it gives origin to thoracoacromial artery, lateral thoracic artery. From third part, it gives origin to subscapular artery, anterior circumflex humeral and posterior circumflex humeral. Now, brachial artery, as a continuation of the axillary artery, it begins at the inferior border of the teres major tendon, and it ends at the level of the neck of the radius, about 1 centimeter distal to the elbow joint. At this point, it divides into the ulnar and radial arteries. For branches, we have mnemonic, that is dogs sprint in rainy underpasses. D for deep brachial artery, S for superior ulnar collateral artery, I for inferior ulnar collateral artery, R for radial artery, U for ulnar artery. Now, radial and ulnar artery. These arteries originate from the brachial artery at the apex of the cubital fossa, with the radial artery descending through the lateral part of the forearm and the ulnar artery through the medial part. Both arteries give off their main branches within the forearm, with the radial artery giving the radial recurrent artery, muscular branch, palmar carpal branch, dorsal carpal branch, and superficial palmar branch, and the ulnar artery giving the anterior and posterior ulnar recurrent artery, muscular arteries, common interosseous artery, dorsal and palmar carpal arteries. Now, venous drainage, it's clinically an important topic because clinically often puncture many veins which are present in the upper limb, so it is important to know what are these veins present in the upper limb. So the upper limb is drained by two groups of veins. One group is the superficial veins, and the other group are deep veins. Superficial veins are subcutaneous. They are present just below the skin within the superficial fascia, and the deeper veins, they accompany the arteries, and they are present usually in the form of venae comitatus. That is, the veins are present on either side of the artery. The deep group veins, they drain the tissue beneath the deep fissure. So these two groups, superficial group and the deep group, they are connected by perforating veins. So let's talk about the superficial veins first. We have dorsal venous network, which is located on the dorsum of the hand, which gives rise to two important superficial veins, which are called a cephalic vein and basilic vein. And we have the palmar venous network located in the palm of the hand, gives rise to median antebrachial vein. So first we shall discuss about dorsal venous arch. It is the network of veins formed by three dorsal metacarpal veins, which are present on the posterior aspect of the hand, and they received the dorsal digital veins and continues proximately as the cephalic and basilic vein. Now, talking about cephalic vein, it begins from the lateral end of dorsal venous arch and runs through the roof of the anatomical snuff box. It courses along anterolateral surface of forearm, then arms, then deltoid and pectoralis major muscles along deltopectoral groove, then it pierces costocoracoid membrane and terminates into axillary vein. It often connected with basilic vein by median cubital vein in front of elbow. Now, talking about basilic vein, it begins from the medial end of the dorsal venous arch and passes along medial aspect of forearm. It pierces deep fascia at elbow and joins venae comitanes of brachial artery to form axillary vein. At lower border of teres major muscle, now median cubital vein, it connects cephalic vein to basilic vein at roof of cubital fossa and lies superficial to bicipital aponeurosis, talking about median antebrachial vein. It arises in palmar venous network, ascends in front of forearm, and empties into basilic vein or median cubital vein. Now we shall discuss about these deep veins also. They are along with the arteries, so the deep veins we can divide into 3 sets: radial veins, ulnar veins, brachial veins. Radial vein receive the dorsal metacarpal veins. Ulnar veins receive deep palmar arches. And lastly, the brachial veins, which are along with the brachial artery. They are all in the form of venae comitantes. Brachial veins are joined by the basilic vein to form the axillary vein and subsequently drains into subclavian vein. So here is the axillary vein, which is formed by the lower border at the lower border of teres major, by the union of brachial veins and basilic vein. And it continues as the subclavian vein at the lateral border of the first ribs. The subclavian vein starts at the inferior margin of the first rib. It crosses superiorly and joins the internal jugular vein to form the brachiocephalic vein.
This is our note. If you want the notes, please comment down below.